Hello, everyone, and welcome to Achieving Net Zero Emissions in the Healthcare Sector. My name is Jamie. I'm going to give some quick housekeeping notices. First of all, thank you all for being here. Everyone is going to be muted and everyone is going to stay muted except for our speakers. If you have questions about this topic, please put in the chat your questions to Ask Me Health Cues. And if you have questions about CCL in general, please send your messages and questions to Ask Me CCL Cues. Thank you so much. And without further ado, I'm going to turn it over to the wonderful Diana Russell.
Thank you, Jamie, and welcome to everyone. I am Diana Russell, and I am the moderator of today's Health Team session. And it's my privilege to introduce Dr. Jeff Thompson. Dr. Thompson is a recognized healthcare leader, a pediatrician, an author, and an executive advisor. He served as CEO of Gunderson Health System, a large integrated system in Wisconsin, and is currently the board co-chair of Healthcare Without Harm. So Dr. Thompson, welcome, and thank you for being with us today.
Thank you. Thank you for inviting me. This is very important work. I'm glad so many people have joined in. It's important for us as a group to gather, and it's important for the country for us to get a lot done. Thanks.
Good. So we'll get started. So you were the CEO of Gunderson Health System and from 2001 to 2015. And as I said, that's a large integrated that's ranked by health grades in the top 5% of hospitals for quality. So tell us a little bit about yourself and how you transitioned Gunderson to net zero emissions.
Well, thank you, Diana. I will tell you just a little bit about myself. Like health systems, we all have other responsibilities. So on top of being a CEO and an ICU pediatrician, I also authored, taught, but I was a husband, a father, a grandfather, a member of my community. Just like health systems and health organizations, they have to decide what kind of organization are they going to be. And we decided we were going to take responsibility for the health of the 500,000 people in our area, rather than just look at them as what part of the market share can we gather in. So to transition our organization, we said we have to look broadly at our responsibilities, not just superior quality, not just great service, but say, what do we do to lower the cost? What do we do to improve the economy? How do we keep our community healthy? How do we go outside our walls? And as we started to do that, you can see then that taking on our pollution, our pollution from all the energy we use, fit well into a pattern of saying, we are not just about waiting until you break your leg or get pneumonia. We are about trying to improve the health and well-being of our community. Financial health, health, education, the whole works. That's what we're about. And so rather than a side project, we fit sustainability, lowering our environmental footprint into an overall picture of this is a responsible organization that serves its community. Technically, we started with that. Now, we didn't go to the board and say, hey, we want to fix climate change. We never mentioned climate change in 2003 and 4 and 5. It would not have gone over well. But we said, if we lower our pollution, if we save money for our organization, and we improve the local economy, can we push down this path of expanding our responsibility to the health and well-being of the community? And they said, well, we don't think that's possible because, of course, it's either jobs or the environment or finances and the environment. It can't happen. But if you could do that, go ahead. And so we went ahead, and we started with conservation, where you get a very rapid return on your money, 60% return on the first $2 million we spent on conservation across this whole big system. And we received steadily increasing support from our staff, from our board, amazing support from the community. So then we got some momentum going, and we were able to transition not from conservation just to generating electricity from renewable sources in our region. So in a matter of 6 years, we were able to have a day in 2014 where this large system with multiple hospitals and clinics, thousands of employees, had its first day of producing more energy from renewables that we owned than we consumed that day. And we saved money, we lowered the cost of care, and we improved the local economy. Did I lose Diana here?
I'll check to see if she's muted.
Lisa,
Okay.
do you want to jump in?
Sure, I can jump in. Thank you very much. So thank you for that answer. And, you know, healthcare is a complicated, highly regulated industry with competitive incentives. Today's COVID-19 pandemic and resulting operating changes have resulted in significant financial losses for hospitals and physicians. What do you think is the best approach to engaging hospitals to support carbon pricing? And when do you think, especially considering COVID-19, that they'll be ready to consider that?
Well, that's a very important question. And as we frame how to move forward with this work to get a carbon pricing plan not only promoted but adopted, I think the first and most important is the same skill, the same approach we need when we talk about addressing one of the other great issues in our country right now, addressing racism. And that is, we need to listen. We need to start out and listen to the leaders and find out what their priorities are. We need to, of course, we have lots of data and we have plans, and we have all these things. We can't throw that in their lap right away. We have to listen and say, what's their priorities? Healthcare is not a monolithic mindset or setup. Some people will have a service focus and say, how do we serve the greater good for the longest period of time? But everyone will maybe say that, but that isn't what really is driving them. Is it expansion? Is it their finances? Is it competition? We have to understand what is really pressing them. What are their priorities? Who is pressing them? Is it their board? Is that how they move the organization along? Or is it community pressure? Is their goal market share or improving the health of the people in that market? These are really important pieces. So we move forward with the what can we understand from the healthcare leaders in the various sectors. The providers of care might have a different focus, might be short-term, might be long-term, than, for example, people in the pharmaceutical industry. Remember, the pharmaceutical industry, when measured by the National Health Service of England, had as big a footprint for the National Health Service as all of their energy costs and all of their materials costs and technology. So pharmaceuticals had a huge, so Merck's or Johnson & Johnson, these other pharmaceuticals might have a different set of priorities than a hospital leader will. So we have to think, what is it going to take? Is it going to take inside people, like showing that you can be done? Is it pathways? Is it outside folks? For example, outside of healthcare completely. Calvert Investments, socially responsible investing. You've been strong, thoughtful, loud voices for investing and paying attention to climate change. But now they're joined with an even bigger investor, BlackRock. $3 trillion BlackRock holds. But the CEO has come out and said, we absolutely are going to downgrade people that are not paying attention to the future of climate and carbon pricing and those things. So build your argument. We have a million things that we can talk about why this is such an important and good route. We have to build the argument that comes to the fore, just like I did at Gunderson, with what's going to appeal to them. If they asked me, what do you think of climate change? I'd have told them straight out, there's more evidence for human-involved effect of climate change than about half of all the treatment we give patients, which is true. There's plenty of documentation to show that. But when I'm trying to get the board to pass it, that's not how I lead. So we have to find out what's important to them and then lead with that.
Diana, do you want to pose the third question?
Pardon me?
Do you want to pose the third question, Diana?
Yes, well, I also would like to know, when do you think, Dr. Thompson, would be a good time for us to begin to approach and engage hospital leaders, since everything they've just been through with COVID-19 has really turned the whole situation upside down, kind of, and they're certainly facing a lot of financial loss. So when do you think would be a good time for our members to begin approaching hospital leaders?
Well, that's very important, Diana, and you, of course, are an experienced healthcare leader, and you understand that that always we focus on quality and service, but when the finances completely disappear, as they have during this, it is hard to try and take care of patients and take care of your staff and take care of the community when there's nothing but red ink splashed all over every ledger that you have. So that's a very important question. That too is going to vary place to place. Every place wasn't hit quite as badly, although even you can't just go by how many coronavirus patients they had. There are many places that had very few patients that still were absolutely devastated by this. So I think we start early on, and I think we start having conversations as early as possible, as early as you can get the time to have it, because part of this is to say, how do we prepare for the future? How do we avoid a next major crunch? And if in fact there is carbon pricing, the carbon intensity of healthcare is unknown to most of healthcare leaders, and they would be stunned to see where they would fall along the potential risk corridors for carbon pricing. So I think we can bridge it as this is important for you to know about. This is important for you to understand. You need to understand that although you have a wonderful recycling program, recycling in healthcare takes care of, maybe a good program takes care of about 1% of your carbon footprint. Research out of New York Langone University. So I think we start early, but go gently.
So, so you were part of Healthcare Without Harm at Gunderson in the practice Green Health, and now you're very active on the board of Healthcare Without Harm. And for our non-healthcare listeners, Healthcare Without Harm is an organization that assists hospitals in the development of sustainability programs to decrease their own carbon footprint, just as you were saying. So Dr. Thompson, how do you think a price on carbon would impact those programs?
Well, that's good. That'd be, it would be exciting for some of them that have worked very hard. We've had over 1,000 institutions working hard to try and decrease their carbon footprint and improve their finances at the same time, prepare for the future. So those folks most of them would welcome it and say, good, we've been working in this direction. This will help us. There's a number of others that would be pretty surprised, but would quickly get on board. And then there's probably half that would be shocked, just stunned, and are pretty unaware at the size of their footprint. The density of that in the United States is a little higher than in many other parts of the world, many parts of Europe, where the health systems are charging ahead at a higher percentage of folks going after it. The National Health Service of England, like I mentioned, is really going. I mean, they have carbon footprint measurements per department in the major hospitals. So if you're in charge of the nephrology department, the kidney department, you would have your carbon footprint for the work that you do. And now they're starting to buy goods based on, like inhalers, based on which have effectiveness and a lower carbon footprint because they have some real goals. So it would be all across the spectrum on how people would react. I believe that nudging this along would, the way we're doing it, we're making steady progress. A carbon tax would logarithmically jump forward because it would so get people's attention and move it along. So I think that's why this is important work, and it'd be so valuable if we could get this done in a way that didn't cost us too much.
Okay, good. Lisa, I think we maybe have time for one question from the chat. Do you have a question for Dr. Thompson?
Yes, a couple people have asked if Medicare for All or a socialized form of healthcare delivery, how would that impact a relationship between HR 763 or carbon pricing in general? Is there any relationship that you see between a type of delivery that was like that?
I think that there's a couple issues there. A lot of time when people say socialized medicine, they mean the government overtaking. If you had universal access with accountable care organizations, whether they're government or not, where the health of the population was the ultimate goal, not doing certain number of procedures, then you could easily draw a line between saying we need to address these issues that cause pollution. Carbon causes pollution. It kills so many people in our country and around the world. And so that would make a good line. So it's the paying for the health of the population is the key, whether it's the government that does it or through private accountable care organizations. I think that's the key that really goes then in sync with a carbon policy.
Okay. Do you have another question?
I do. Let me just pull it up here. Do you have any suggestions about how to approach a hospital system, whether it's better to go to a CEO or to a board, and if the board is not on board, supportive, how would you deal with that kind of interface?
Well, that's a very important question and shows some good insight and maybe a few battle scars. I had an advantage because I was the CEO and board chair, so that's kind of cheating. So we were able to go along pretty quickly, although board wasn't asleep. I mean, they paid attention. We had to measure everything and follow very carefully. What I would say is it is always good to have an internal champion, regardless of the level. So if you can get a doc or a nurse or a pharmacist or an administrative vice president who has a real passion, and you can educate them, help them, teach them, help them find some wins, that will help out. If you can find one of their competitors that's doing great work and put that on the table, give that information and just say, here's where these people are going, and here's all the philanthropy they got, and here's the new hires they're getting. There's engineering firms, there's Lockheed Martin in this country. Lockheed Martin is looking hard to find socially responsible engineers, and they're getting tons of them because that's what many of the young kids coming out. So if you want to recruit, this is a way to go. So you start building that argument with whoever is the most passionate, and then help them build the case for you.
Great. Well, that's a great lead in to letting our listeners know that the health team has developed 2 declarations that support placing a price on carbon. One is for hospitals and healthcare systems, and the other one is for health professionals. And these are documents that can be used to help engage either CEO or the board or other health professionals within an organization. And we've put a link to those documents in chat. But I also want you to know that there are more resources on the health industry outreach site on CCL Community. There you'll find information about the health impacts due to climate change, how climate disruption has impacted hospitals, and links to other resources, including the hospital and health system and professional declaration. So with that, I'd like to really thank you, Dr. Thompson, for a very informative discussion. And if you have any last parting comment for us, that would be great.
I think we actually don't have time for parting comments. Thank you, everyone.
Thank you for listening to this episode of Citizens Climate Lobby's training program. You can tune into more episodes anywhere podcasts are available. Inspired by what you heard today? Join Citizens Climate Lobby to advocate for bipartisan climate solutions. Go to community.citizensclimate.org to find more trainings, resources, your local chapter, national action teams, discussion forums, and more. Be sure to like our Facebook page and follow us on Twitter and Instagram @CitizensClimate. We also invite all of our listeners to subscribe to our YouTube channel for more inspiration. And together, we are creating the political will for a livable world.